Hello, my name is Katie, and I had the opportunity of doing some undergraduate research as the research chair for Eta Sigma Gamma with Sophia Root, and then our faculty mentor was Keely Reese. And our title of our research is Analyzing the Effectiveness of Mental Health Community Care, Caring for Ourselves and Each Other. So to start, this program was introduced at the University of Wisconsin-La Crosse to address mental health concerns among young adults, especially following the COVID-19 pandemic. And the goal of this program was to reduce stigma around mental health and increase skills related to emotional regulation, self-compassion, and boundary setting and overall mental health recognition. And so the goal of our research was to focus on evaluating the effectiveness of this program, specifically examining how participants applied the skills they learned in their daily lives 1 to 2 years after attending the training. So our research objectives that we included on this poster include identifying which knowledge and skills participants retained from the training, assessing how participants applied these skills to recognize and manage mental health issues in themselves and others, and explore science or specific instances where participants used the skills they learned to support themselves or others during a mental health crisis. And so the theoretical framework, as all research is framed around theories and models, we chose to use the social ecological theory and the theory of reasoned action and theory of planned behavior. And so this is a little diagram here that shows how we broke that out into each theory. So the social ecological theory emphasizes how individual behavior is influenced by the community and broader societal factors. And then the other two theories that we included focuses on attitudes, intentions, and self-efficacy toward mental health practices and helping others to understand participants' beliefs about applying what they learned from, we call it MHCC, which is the training program. And then up here, we go into our methodology. And so this study used some qualitative research methods, including 2 focus groups with 11 participants who attended the program at UWL. And participants were asked about their experiences with mental health, how they applied the training in their lives, and the impact of the skills on their relationships and well-being. And so data was collected through audio recordings and note-taking. So we had a facilitator and a note taker at the focus groups, and then we used audio recording to go back and make sure that we caught everything. And then we analyzed using deduce qualitative software to identify common themes, which we'll get to a little bit later. And then some key findings that we have here. So overall, self-compassion and mental health awareness. Participants reported increased self-awareness of their own mental health and embraced self-compassion. They found it easier to acknowledge their emotions, practice self-care, and create space for activities that brought them joy. And then number two, another key finding, recognizing mental health in others. So participants learned to better recognize mental health struggles in others, moving away from the fix-it mentality. They adopted more empathetic, non-judgmental approaches to supporting others and used co-regulation and active listening to provide more authentic support. And then number three, the last common theme that we found was boundary setting. And participants reported significant improvement in setting personal boundaries, which boosted their emotional well-being, confidence, and overall energy. And this skill was often used to protect their mental health by distancing them from negative influences and managing stress. And so, like I said, we would get to the more how we coded these focus groups. And so we used this deduce, which we were able to pick out and code both focus groups and then total them over here. And so some code examples include benefits, boundary setting, co-regulation. And so those are common themes that we chose to just pick out words that matched those codes. And then we were able to see which ones came up most frequently throughout the focus groups that participants brought up. And then overall conclusions. So the MHCC training effectively helped participants develop essential mental health skills such as self-compassion, boundary setting, and empathy. And these skills improved participants' ability to manage their own mental health and support others. And overall, the training was seen as beneficial, and participants actively applied what they learned in their daily lives. These findings suggest that MHCC is valuable program for college students and could be expanded possibly to other populations. And so our further recommendations that we included, these were based on the feedback from focus group participants, of course. And so several improvements were suggested, like implementing a virtual or email-based follow-up to refresh skills annually, shortening the training to increase engagement, expanding outreach to non-health related majors. And that is something that in our inclusion criteria was only people that attended the program, and those people, students, happen to be in public health majors or health related majors. And so expanding that out to maybe business or other majors within a university. And then enhancing the focus group or focus on navigating mental health crises. That was another improvement that was suggested from the participants. And the MHCC program will continue to expand with further data collection and focus groups planned to refine the training. And the program's implementation will also extend to other campuses and communities promoting mental health resilience nationwide. And then last but not least, some acknowledgments that I would like to shout out people include Sarah Johnson, who created and implemented the MHCC program, and Dr. Keely Reese for her mentorship on this research project. And this project was funded by, it's called SCREL, and involved contributions from the research team, as well as Sophia Root. So thank you guys very much for paying attention to our research project.